We've been talking about this for a long time, Gavan.
This has been on the cards, Colette, since at least 2016 or 2017, because this was one of the findings or one of the recommendations of that all-party Dáil committee, which comprised the Sláinte Care plan, which was published now 5 years ago. And indeed, this plan itself was adopted by Cabinet 3 years ago. But if it all works as it seems to do on the tin, then it would actually make things an awful lot simpler and cut out a lot of bureaucracy. And that's because right now in Ireland, the hospital groups are assigned into 6 different groups. That basically hospitals are grouped with resources shared on a geographical basis. But separate to that, there are also 9 community health organisations in the HSE, and the two maps don't completely add up, which means that if you're being discharged from a hospital, that there isn't always necessarily some clarity as to which community health area you end up being discharged into, and there's a little bit of a disconnect in how care is managed. The idea now is that those two maps would be identical, and Stephen Donnelly, on his way into Cabinet, said that it could have significant practical benefits.
Over the last few weeks, we've had in and around 600 patients in the system who've been discharged from hospital, but they haven't had an appropriate care setting to go to. Now, a lot of the reason for that is COVID and the extra pressures that it's putting. But if we join all of that up and we stop looking at someone being in either a nursing home or a home care situation or a hospital or a primary care centre and say, really, we need to design healthcare around the patient rather than around the system. It's one of the things that will help.
So the idea being, as you heard Stephen Donnelly say there, that the idea would be to plan the system around the patient and not necessarily the other way around. And that would mean that you'd have much more coordination between community health services and hospitals. But there is another question about all of this as well, and that's how these regional health organisations are going to be governed. It may be something akin to the health boards that we used to have before the HSE came into place. But Roisin Shortall, who was the chair of that Sláinte Care committee back in 2016, is pointing out that there does have to be full accountability for the people managing at local level.
The buck has to stop with senior management, and like I've made the point before, there's a lot of senior managers within the HSE. They're very well paid, but I've yet to see a senior manager been sacked for failure to provide adequate services and for spending a budget properly. So that's a key element of the regionalisation plan.
And regional organisations like that are going to need fresh legislation to be put through the Dáil and Shannon. It would basically turn the HSE into something of a mini government of its own, where you would still have a national umbrella group, but then you would have a much more federated model where you'd have local managers being responsible for care on the ground in individual regions without necessarily having to answer to Dublin for that. It would be a major restructure of the health service, and it is something which opposition parties are keen to see, but they are waiting to see how long it might take for the legislation to enact that to be brought forward.